Hello guys, welcome back again to yet another exciting video on rheumatoid arthritis. Now I have prepared videos about rheumatoid arthritis and osteoarthritis and even gout and the differences and how to manage them. So these videos will come to you in a stepwise manner. So just be patient. Okay, so today we are talking about rheumatoid arthritis. This is Dr. Lewis and this is the Health and Wellness Spot. Now, what is rheumatoid arthritis? Rheumatoid arthritis is a disease that basically affects most people who have a lot of weight, people who have a messed up diet, people who have adrenal insufficiency, and people who have a lot of cortisol in their system as a result of the stress they experience in their life, everyday life activities. So rheumatoid arthritis is actually an autoimmune condition. And when I mention autoimmune, I'm basically targeting what is happening to the adrenal glands on top of your kidneys. Most autoimmune conditions hail from the gut, others hail from a failing adrenal gland, because remember, if you have an autoimmune condition, you are given a steroid drug, for example, dexamethasone or prednisolone. And the reason why you're giving that is because you want to suppress the overreacting immunity. That tells you that you're already supplementing the adrenals because they are failing, because these steroids come from the adrenal glands. So intrinsically, the adrenal glands are the ones that are responsible for production of these steroids. But once you get an overreaction in the immune system that exceeds the ability of your adrenal glands to fight it, then you require an external shot of a steroid drug to just suppress your immunity. So rheumatoid arthritis is part of the autoimmune conditions. And when I say autoimmune, I mean your own body cells, your own immune cells start targeting the tissues in the joint or the cartilage. Now, once they target that cartilage, remember this is just a representation of a joint. So we have the synovium here, we have the cartilage, then we have the tendons. So when you have your own immunity trying to clear out this cartilage, so basically cleaning out this cartilage and then exposing the bone to each other. So once you destroy this cartilage and that synovium, then you expose the joint to each other. Then that friction brings about inflammation, brings about a lot of pain, stiffness, and that is the reason why you start getting that pain from rheumatoid arthritis. So it's an autoimmune that targets the cartilage in the joints and start destroying your own joints. And this happens in your fingers, your wrists, your knees, and sometimes even your ankles. So it's so painful, and most of people will tell you that when it becomes cold, they start feeling a lot of pain and they can't move. So they will blame the cold and not work on the cause of the arthritis. This is the same issue with most medics. They target a relief of symptoms and they will tell you that rheumatoid arthritis is not reversible, or even other forms of arthritis, they're not reversible, that you just have to cope with the disease. That is not true. You can reverse this through the methods that we'll talk about as we go ahead with the video. So why do we need to treat this condition? Because this condition, if you left to establish itself over a period of time, even though you're using those painkillers, those over-the-counter NSAIDs, and all those drugs that are prescribed for this condition, you are letting this condition establish itself behind bars. So you're treating the symptoms and allowing the condition to establish itself behind bars. And as it establishes itself, it keeps on destroying the joint. So the reason why we want to handle this is because we want to help you get your joints back, so you prevent a deformity. So those are part of the reasons why you should treat this condition and avoid the complications. So one of the complications of rheumatoid arthritis is basically joint deformity. So you'll destroy your joint. So if you're targeting the treatment of the cause, or managing the cause, then definitely you start to recover from joint deformity. Again, remember, as it establishes itself, it reduces or it destroys the organs that are lying near to that joint. And this is a serious one because it goes deeper into the organs and it can cause organ damage. Again, we want to improve the quality of life and help you achieve that movement. We want to help you achieve higher quality of life and a prolonged life. So we will handle the cause in this one. So most drugs, you'll really understand that they'll only treat the symptom, which is pain and inflammation. However, after you finish a dose of that steroid or a dose of that painkiller or NSAID, then again this condition comes back. And why does it come back? Because of course, definitely, you and your healthcare provider have decided to focus your attention on just handling the minor symptoms and not the cause. So the cause, we already said, is the overreaction of the immunity, so it's autoimmune. And number 2 is adrenal insufficiency. So if you have adrenal insufficiency, you will not be able to produce the adrenal glands, the adrenal hormones that will help you fight this condition. Again, sometimes you have adrenal insufficiency, yet you have a very high amount of cortisol in your system because of stress. So that hormone is very detrimental to your joints. Again, remember, this cortisol is a hormone that is part of the counter-regulatory hormones, the ones that you produce in the morning when you're preparing for a new day. So it pumps glucose into the blood. It instructs the liver to break down glycogen to give you glucose to prepare for the day. So that tells you if cortisol is high, then definitely your blood sugars will start going up. And remember, on joint inflammation, sugar is a very major player in this one, as we'll talk about it in diets. So basically the cure of this will only lie in you managing the inflammation and you handling the adrenal insufficiency. And that's the reason why we're here. So how do you start treating this? The number one thing here has to be the diet. So if you're just eating anything at your disposal, you're consuming those wheat products, of course the highly inflammatory foods that we eat, all of us, the sugars in all forms, be it natural in quotes or be it the synthetic sugar, all those affect your joints because they are highly inflammatory to the system. If you're consuming drugs that also alter the function of the joints, if you're consuming foods like the seed oils, the processed foods, meats that are processed and packaged, all those foods that you buy in the supermarket, the wheat products, the simple carbohydrates, what they're doing to you is they're actually lowering your immunity. And this will sometimes cause an autoimmune. Again, remember, these foods alter your gut. They cause the gut to be perforated, maybe a leaky gut to be even a little precise. Once they cause a leaky gut, that tells you, number 1, you will not absorb nutrients that are supposed to nourish your joint in the adequate amounts. That is one. Number 2, you will now start having an autoimmune because, again, every substance that gets into the system, every protein that gets into your system gets to be fought by the immune system because it treats them as foreign. That is where you start getting those psoriasis, the skin conditions. That is where you get the eczemas. That's where you get the protein allergies. And that's where you start your autoimmune. To add on that, sugar kills the kidneys and the adrenals. Once that happens on all those inflammatory foods, the seed oils, once you kill the adrenals, then what do? You've gone into adrenal insufficiency because you're not able to produce adrenals as expected. And then that will lead you into autoimmune. And what do? We will give you a shot of maybe a steroid direct into your joint to start helping you to recover from these symptoms, but not the cause. So number 1 on the list of treatment, you have to edit your diet. Drop seed oils, drop wheat products, drop soda and carbonated drinks, drop anything that is highly inflammatory to your gut like wheat products. Drop sugar in all forms. Once you do that, then you've started your route to recovery from arthritis, the rheumatoid arthritis for that matter. Then fasting. I've already told you that prolonged periodic fasts, a 48-hour fast, a 72-hour fast, these are super treatments. You get into autophagy. And the function of autophagy is just to clear cells that are wasting time, dead debris, those organelles in the cells that are dead, but they cannot be excreted. So it turns them into healthy energy for you to utilize it. Again, those cells that have been destroyed along the joints are destroyed or are turned into helpful nutrients for the joint and also for the body in general. And finally, the autophagy is a basic healer of all autoimmune conditions because it stabilizes your immunity, and also it suppresses the hyperreaction of the immunity, and then it heals inflammation. So once you start healing inflammation, definitely the swelling will disappear, the pain will disappear, the discomfort will go, and the flexibility of the joint will be rejuvenated. So therefore, start fasting if you're told you have arthritis and rheumatoid arthritis for that matter. Even the osteoarthritis, all of them will just disappear once you start fasting, because fasting is the secret medicine that hospitals don't want you to know. Then, when you're fasting and when you're impressing diets, what are you doing? You are actually trying to lose weight also. And once you lose that weight, then you start reducing the pressure that is exerted on this bone or on this joint. so that the friction reduces and you start to recover. Therefore, three things are supposed to be combined. You combine diet, which is healthy keto, basically go on a zero carbohydrate diet and zero sugars. You combine the fasting, possibly 1 meal a day every day, and then you can do possibly a 48-hour fast or a 72-hour fast after 2 weeks. That will help you. And then now combine that with exercise. Go to the gym and lift. Go to the gym and do some exercise. Just be involved in activity, okay, so that you rejuvenate the tendons, and if at all the tendons have been ruptured or destroyed, so you can rejuvenate from that. So those three will help you lose adequate amount of weight, and this can be handled by your joints. Most of you experience this because you put up a lot of weight, and this happens mostly in women because they have put up a lot of weight, and this weight is exerting a lot of pressure on these joints. So even without the autoimmune, you'll be destroying the cartilage by just that friction on that joint. Okay, so exercise is very important, fasting is very important, and diet is very important. Now, if you've already gotten worse here, then we can also combine that. So you'll have to hold on the exercise because it can be dangerous to the joint already. Then you can go for physiotherapy. You can visit a physiotherapist so that they can clear or help you just to flexing your joint, and possibly all those simple exercises and those massage that will help you relieve some pain. Then the last two is basically medicine and surgery. Now, on the surgery part, personally, I recommend drugs and surgery as the last option in therapy, specifically for these chronic conditions. Okay, because these are dietary conditions, and these are basically chronic conditions. They can be handled through dietary modifications and other interventions. Drugs have to come like second last, and surgery has to be the total last one. If at all you've destroyed your synovium, so this is the synovium. If you've destroyed it completely, then you can go for surgical procedures that will help you maybe remove the inflamed synovium, and that is what we call synovectomy. So synovectomy is just a procedure that removes that inflamed synovium so that it can help you recover or help you relieve the pain and inflammation. Another one is tendon repair. In case you've altered this and they have ruptured, then definitely you can go for a repair of the tendons. It also proves to be helpful in recovery of the symptoms. Then joint fusion. At some point, you get the cartilage has been destroyed completely. So what is remaining is just the bone being exposed to another bone, and that friction is very dangerous, it's very painful. So you get all that inflammation. So what you do, sometimes you go for the fusion. They just fuse this bone and this. So that can alter your flexibility, but this has to come on the extreme ends. So you join the bone so that you reduce the friction. But now you can realize already you've altered your flexibility. Then the last one has to be total joint replacement. So that's why they use the metals or the plastics to just joint and replace the total joint that has been inflamed and destroyed. So those are just part of the surgical procedures that can be done to help you recover from rheumatoid arthritis. However, on drugs, this is where the problem comes in. Now, we have different groups of drugs that can help you recover from rheumatoid arthritis. One of the group of drugs that can help you recover from rheumatoid arthritis is definitely NSAIDs. Now, non-steroidal anti-inflammatory drugs, as we've always mentioned here, the problem with these drugs is the side effects. So remember, dietary modifications do not have any side effect. That's the point about chronic conditions. So you need dietary modifications to help you recover from chronic conditions. But if you go for drugs directly, for instance, most of you like getting those over-the-counter painkillers and those prescription medicines to just help you recover from these conditions. However, understand that drugs are poisons in regulated doses. So the more you expose yourself to higher doses or prolonged use of these drugs will cause you a lot of issues. Now, let's go through the side effects of these drugs so that you can get to understand where we go wrong. For instance, the NSAIDs, a very common drug that is used over the counter and sometimes as a prescription-only medicine. So NSAIDs like ibuprofen, okay, like diclofenac, like meloxicam, aceclofenac, all these, naproxen, and the ones that is supposed to be regulated and prescription-only medicine is celecoxib. These are the coxibs, the ones that don't cause the peptic ulcers, or they don't affect people who have peptic ulcers. However, they have a very big problem with the kidneys and the heart. So all these drugs have issues with the kidneys and the heart. So they reduce renal perfusion. So they reduce the flow of blood towards the kidneys. That tells you they start affecting kidney function. And that's the reason why these drugs are supposed to be avoided in people who have a heart problem or a kidney problem. Again, the normal one is gastric pain, gastric or GI bleeding. So you'll get that ulcer. So they cause ulceration because they alter the mucosa of the gut. And once they do that, then you start getting that bleeding, you start getting that malfunctioning gut, and therefore you'll not absorb nutrients in their adequate form. So this can lead you into nutrient deficiencies, and that bleeding, if it's prolonged, then you can go into anemia. So these drugs are very dangerous. And remember, if they kill your kidneys, then automatically you will get into uncontrolled blood pressures. You'll get into toxicity, electrolyte imbalance, water imbalance, because the kidney does all those functions, and even anemia because of erythropoietin. So that's why these ones are drugs come as last therapy in this channel. Okay, so we encourage you to modify your diet more than going for drugs. So that is about the NSAID. So the next group of drugs is what we call steroids. And anytime I talk about steroids, people think these are drugs that are used to boost your muscles in the gym. Yes, but that is anabolic steroids. But other steroids, this one is non-steroidal, and these ones are steroidal drugs. So these are drugs that are used to relieve inflammation and pain, and this is for chronic conditions. Examples has to be prednisolone, the ones that we know, for asthma, for arthritis, and all those. So one has to be prednisolone, other ones have to be methylprednisolone, and this one is the one that is injected directly into your joint to relieve the inflammation. I wouldn't mention the trade name, but most of you know it. Okay, then we have hydrocortisone, and then we have dexamethasone. So all those drugs that end with ONE, most of them are steroidal anti-inflammatory drugs. So these are the drugs that are used to also help in rheumatoid arthritis. Now, these drugs have also other side effects. Number one is you'll start getting that buffalo hump. So you'll have this accumulation of fat along your back area, upper back, and then you look like this hump. You're developing a hump. Also, they have an issue with the kidney failure. So they cause kidney failure. Okay, just like the non-steroidal anti-inflammatory drugs. Now again, you're using a steroid drug to help you manage a joint condition, and then what you end up in is osteoporosis, sorry. So you're treating rheumatoid arthritis, then you end up in weakened bones and bone malfunctions, which is osteoporosis. That is a problem. Again, people who use these drugs for a long period of time, they come out with hip joint fractures. So you cannot use a drug to treat arthritis and then come back with another bone issue. That doesn't make sense. Above all, I just mentioned here that if you use these drugs, you will start telling your liver to produce glucose and pump it to the system. So one side effect of these drugs is basically hyperglycemia. So it can bring an increase in blood sugar levels. So this can't be used in diabetics because it will cause an issue with diabetes unless you have started editing your diet. So again, weight gain is part of this, okay? And then eye problems. So it exposes people to cataracts. And then the major one is it lowers your immunity. So overuse of these drugs can lower your immunity, causing you infections and all that. So you don't want to get yourself into that. However, if you're at extreme ends of rheumatoid arthritis, then definitely you'll never avoid drugs. Okay, so we want to work on reversing that more than using the drugs. The other group is DMARDs. This is disease-modifying antirheumatic drugs. So these are drugs that automatically are used to suppress your immunity. Those people who are expecting to get maybe a kidney transplant, or those transplants, organ transplants, can be put on these drugs to suppress their immunities. So these DMARDs, example is methotrexate, and methotrexate is also an anti-cancer drug. Okay, so methotrexate, hydrochloroquine, and leflunomide. Also sulfasalazine lies here. So these are drugs also that suppress your immunity. So you can imagine again going through the same process, because steroids and DMARDs suppress your immunity and they expose you to different conditions. Now, an interesting drug in this group has to be hydroxychloroquine. This is a drug that is basically an anti-malarial drug. But I want you to also understand that this is a drug, for those of you who still have fresh memories about COVID-19, this is a drug that was specifically suggested or indicated in conjunction with azithromycin to help you manage COVID-19. Now, when questions started coming in or flowing in about this drug, then it was withdrawn. The therapy between the combination of hydroxychloroquine and azithromycin was withdrawn in management of COVID. And why is that so? The reason is hydroxychloroquine, apart from it being an antimalarial drug, it is also an immune suppressant. So it has been proven to suppress your immunity. So you can imagine viral conditions rely on your immunity. So if you have a strong immunity, then viral conditions will not get to you. And that's the reason why COVID hit hard people who had cancer, people who had HIV, and people who had diabetes because of low immunity. So this is a drug that lowers your immunity even more. So now come to think of it, why was this drug used to treat COVID, yet it suppresses immunity? And COVID was a viral condition, which means it just created an adequate and or an optimum environment for COVID to survive. So this question was, this drug was totally questionable. And it's still being used here to help you manage your bone and joint infections or your rheumatoid arthritis, and still suppresses your immunity. So you'll expose the same joint to infections. So these are drugs that you're supposed to avoid, and these are drugs that are supposed to be used under strict monitoring. They also affect the liver and kidney functions, so stay away from them unless prescribed by the doctor. And if so, talk to your doctor and start editing your diet. So if your doctor just gets the prescription pad and starts writing these drugs, then definitely know it's time for you to fire your doctor. Then the last group is biological response modifiers. There we have rituximab. We also have abatacept. Also infliximab is here. So these are drugs that are used rarely, but they are the new therapies in management of rheumatoid arthritis. So basically that is rheumatoid arthritis. However, if you cannot contemplate anything on this board, the only thing that you should know is this is an autoimmune condition, and autoimmune conditions hail from the gut and also from failing adrenals. So how do you reverse that? Reverse it through the diet, healthy keto, reverse it through fasting, lose that weight, exercise, and then if at all these are not working adequately or fast as you expect, then definitely your doctor can recommend a drug.